Welcome back, guys. It's Dr. Somji.
And Dr. Solomon here.
So today we're going to be talking about how to address this. They're called marionette lines, or they're also called resting face.
Or sad face.
Sad face. Why
Yeah.
so serious?
Patients come in and ask us, I look sad all the time. My daughter, my granddaughter, my son, my grandson, my niece, my nephew. Or I look in the mirror and I always look sad. Help me.
Well, this is the thing, like we're kind of joking about it, but the whole point about having cosmetic treatments is to be more comfortable with yourself when you look in the mirror. That's one thing, but also more engaging in real life because, hey, men have treatments too. Men want to look a little bit more powerful, a little bit more masculine. Females want to be also looking a lot more stronger. They want to be a lot more engaging. So every single person wants to improve their image, not only for the mental benefit, so improving your mood, but also how you appear to other people. Because everyone says, I don't give a about what other people think about me. That's true. We wouldn't be doing that. But it does matter how you're viewed in your career, in your general life. So if you've got a sad face, then you're suddenly a lot more negative to people. You might seem upset when you're not actually upset. So, the human mind is terrible. It creates all these sort of images and, let's say, assumptions about people. So it's a really important area to correct. Now, does a facelift help in that area?
A facelift can help, but a facelift is surgical. And a facelift can help because you can essentially physically lift those areas up.
Yeah.
However, there are lots of non-surgical alternatives to that,
so
which addresses actually the source of the problem.
Exactly. So we need to understand what's going on because the facelift is lifting it back like this.
Yeah.
And a lot of people, you're looking in the mirror and say, look, if it doesn't go when you're doing this, it's not going to go when you have a facelift, really. What causes this problem in this area?
Okay, very good question. Essentially, it comes down to three main issues. The first issue is a loss of volume, and you lose volume as in fat volume in the area. So you lose volume there, and therefore you have a sort of sinking in of the skin and a descent of the skin. So the fat pads...
So it's that witch chin, right? So
Yeah.
you lose volume in this area, in the bone. It's called the labiomental crease, and the chin slowly comes up, and then you start seeing these jowl formations. You can see it in the picture as ages go by. You can see that slow descent of the flame.
Yeah, so you lose bone volume, you lose muscle volume, and you lose fat volume, particularly here, and also in the midface, remember?
And the skin, right?
And the skin. So that volume loss is predominantly the cause of that sad appearance. But also we lose laxity. We lose laxity, the second point is in the skin, and we lose laxity in the muscle.
Yeah.
So it's a combination of volume loss, skin laxity, and muscle laxity as well.
So look, we've got a before and after image looking at a patient that saw me for marionette lines a number of years ago, and it just proves that this patient's only had non-surgical treatments. All she's had is filler restoration in the chin area to replace that lost volume, but also radio frequency tightening around beyond this area because you want to tighten this area. A lot of people think you need to tighten right there, but what you want to do is create contraction, so this lifts. So what are your options for tightening this area to help lift this area?
So there are two options. I like to use Sculptra, which is a collagen stimulating injection that's very popular, you've been using for many years. And that is essentially you inject that into the mid to upper part, lateral parts of the face to tighten that.
So this L-shaped
Yeah,
area.
the L-shaped part, and that tightens that layer of skin and tightens the skin by stimulating collagen. And what that starts to offer is that lift, lateral and vertical lift. But I also like to put a bit of filler in the upper part of the upper third of the face, and what that does as well, it provides support and also a lift by stimulating action of the muscles.
Doing this basically.
Yeah, you're stimulating the muscles which lie under there by stretching those muscles. As you stretch those muscles, they will lift the lower part of the face. The filler itself doesn't lift, but it's the stimulation of the muscles in that area that lifts. And you provide a projection there, so you also provide the sort of illusion, the contour, as well as a physical lift indirectly.
So we talked about filler, how you can replace it. We talked about tightening, we talked about collagen stimulation, but there's also really a method that if you use that muscle, that sad muscle a lot, and you can do that, I call it like the Michael Schumacher, like downturn mouth, like he used to be famous for that. And if you've got those strong muscles, there's a simple quick treatment that you can do to prevent that muscle from causing damage, i.e. breaking down the fat, and you can break that habit, right?
Yeah, so that's one of the most popular treatments in cosmetics and aesthetics and non-surgical as well, and that is Botox. That treatment is one of the most popular treatments in non-surgical aesthetics, something that we've used for as long as we've been in aesthetics, and it's one of the most popular treatments around, and that's botulinum toxin, or Botox. And what you can do, those muscles, those muscles, the sad muscles, you can inject them to relax them, to at least provide the support or stop that pull down to allow you to support it physically with the other treatments.
The other areas which you can inject is these muscles. And they, like, these bands tend to be connected to a jowl, and they tend to be really strong.
And they're called the platysma muscles. You can see it. People often come to us and they say, I want to get rid of those lines.
So you can then put kind of Botox in the muscles that bring down the corners of the mouth. And then also a treatment which I love doing, which I do a lot, is very superficially, just in the skin, you can support the corner of the mouth with a touch of filler. You don't want to do too much because you can actually make it look worse over time period, but you can definitely put a little bit more. So deep volume over here and then more superficially up there.
So we've provided lift laterally and in the upper part of the face. We've added a bit of volume deep to the bone here to sort of elongate that area and provide some support. Superficial filler around those areas, relax those muscles here. And finally, you can physically lift the area once all that's done with some threads.
Yeah, absolutely. So if you've done all of those treatments, like combination treatments, which are general maintenance for aesthetic treatments, you can then place some threads into that fat layer over here, into where the jowls sit, to help lift the area and suspend it. And it will stimulate collagen in that lifting line. And that's really a nice combination approach. Thank you so much. That's all from us today. If there's any topics that you want us to talk about, just let us know in the comments below. Don't forget to click the link to subscribe so you'll be the first to know about all upcoming videos.